Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog I talked about part 1 of the 10 signs the intensive care team is not genuinely interested in your critically ill loved one and you. You can check out the last blog by clicking on the link below this video. In this week's blog I want to talk about part 2 of the 10 signs the intensive care team isn't interested in your critically ill loved one and you. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "Most families of critically ill patients in intensive care, when first confronted with this once-in-a-lifetime experience of having a loved one critically ill in intensive care, have no idea and are absolutely clueless when dealing with the intensive care team. They often don't have the hint of an agenda what to look for if they and their critically ill loved one are in the right hands, and if they can trust and feel safe to put the life and health of their critically ill loved one in the hands of strangers." The fact of the matter is that whenever intensive care treatment is required for a critically ill patient, the machinery that is intensive care is set in motion that you and your family are absolutely clueless about. Intensive care, the politics, the hierarchies, the competition for limited resources, the psychology, the dynamics, and the intrigue tend to be so powerful that if you and your family don't have the right advice at hand, that you will keep struggling making informed decisions, getting peace of mind, control, power, and influence. If you and your family do have the right insights, the right advice, and the right guidance, making informed decisions, getting peace of mind, control, power, and influence will be easy and effortless, because you can quickly see the cracks in the intensive care system and use those insights to your advantage. If, on the other hand, you do and copy the behavior of 99% of the families of critically ill patients in intensive care, you will stand no chance, and you won't be able to make informed decisions, getting peace of mind, control, power, and influence. So let's get into today's topic and let's look at part 2 of the 10 signs the intensive care team isn't genuinely interested in your critically ill loved one and you. So let's continue with number 6. The intensive care team is more concerned about their financial budget, their bed occupancy, and medical research than frontline services that are of benefit to your critically ill loved one. This one might not be all too obvious for you and your family, because chances are that you are so far outside of your comfort zone that you can't see the wood for the trees. But given that it's not all too obvious for you and your family, it's even more important that you get a handle on this very quickly. And given that 99% of the families of critically ill patients in intensive care make no informed decisions, have no peace of mind, no control, no power, and no influence, you and your family need to pay even closer attention to what's happening behind the scenes in intensive care. Intensive care budgets are often made up of different components, and one of the components is medical research. From my perspective, and also from my experience after more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also have worked as a nurse unit manager for more than 5 years. Medical research is everywhere in ICU, and it's yet hidden away from families in intensive care. Millions of dollars of funding per year is poured into medical research in intensive care units, and it's money that's being taken away from frontline services. Therefore, in some instances, critically ill patients in intensive care that are enrolled into medical research studies may get preferred treatment compared to critically ill patients who are not enrolled into medical research studies. Critically ill patients who are not enrolled into a medical research study or who are not eligible to be enrolled into a medical research study may attract less interest and also fewer resources allocated from the intensive care team. Many critically ill patients in intensive care are also often enrolled into medical research studies without their or their family's written or verbal consent. Financial budgets in intensive care. The bed management strategies from the intensive care team in an environment where ICU beds are in ever increasing demand, as well as the intensive care team's interest in medical research, make intensive care a highly unpredictable environment for families as well as for critically ill patients. And if you don't have an understanding of how intensive care units operate on a financial, bed management, operational and also clinical level, you may as well get together with the 99% of the families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power and no influence. Understand and learn how intensive care units operate on a financial, bed management, hierarchical, political, psychological and clinical level, and you'll be ahead of the game, and you'll have tools, insights and strategies at your disposal that help you start managing the intensive care team very quickly. Therefore, all progress in life starts with facing and understanding the truth. I have written an ebook about this, the 10 things you didn't know are happening behind the scenes in intensive care that hold you back from making informed decisions, having peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. And I've linked to this ebook in the written version of this blog below this video. Let's move on to number 7. The intensive care team is trying to avoid you. That's another one of my favorites. Intensive care teams are often trying to avoid families of critically ill patients in intensive care. They're trying to avoid them, especially when it comes to having difficult conversations. They all pretend to be busy, and therefore they're often trying to avoid you and your family at all costs, and only step forward when it's convenient for them. You can almost always be certain that if the intensive care team is trying to avoid you and your questions, that they're not being open, transparent and honest with you. You can almost also be certain that by the time they're going to want to meet you, that they want to do so on their terms and not on your terms. They have set the scene and the agenda by letting you wait, and when they are ready to meet, they often want to do so in a setting that suits them and not you. By the time the intensive care team is asking for a formal family meeting, most families in intensive care are doomed because they haven't seen it coming. They don't know what to expect and they don't know where to go from here. They don't know that the intensive care team has a clearly mapped out strategy when going into a family meeting, whereas you and your family don't have a strategy unless you have the right tools, insights and tactics at hand. Again, I have written a manual for families in intensive care to attend family meetings. Again, I put a link below this video in the written version of this blog. Let's move on to number 8. The intensive care team is making decisions without asking you. Now, intensive care teams need to make decisions 24 hours a day, 7 days a week and 365 days in a year. It's the nature of the environment and it's the nature of intensive care because it's such a dynamic and volatile environment. It would be of no benefit to anyone if the intensive care team asked you about every little decision they have to make. However, when working in intensive care, or when working with my clients one-on-one in my counselling and consulting practice, I have found that the more difficult and challenging the situation is, the more families need to be involved in and informed in the decision-making process. For example, if your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is not waking up after an induced coma, or is in intensive care for long-term treatments and long-term stays, including long-term ventilation, or is having a severe or traumatic head or brain injury, or is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or is in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment might be quote-unquote in the best interest for your critically ill loved one, or your loved one may be approaching the end of life in intensive care. Those are the situations where you and your family need to be transparently informed and also involved in the decision-making process to ensure you and your family get the best outcomes for your critically ill loved one. Especially when it comes to issues like NFR, which stands for not for resuscitation, or DNR, do not resuscitate orders, as well as withdrawal of treatment or limitation of treatment situations. Intensive care teams can be pretty ruthless and make decisions for you, for your family, and for your critically ill loved one that you most likely won't agree with. And here we are clearly about talking life or death decisions. Over the last week or so, I have been working with 2 clients, and both clients felt pressure to agree to withdraw treatment on their critically ill loved one as being quote-unquote in their best interest. The family members of my clients who are still critically ill in intensive care also both had NFR, not for resuscitation, or DNR, do not resuscitate orders issued by the intensive care team without the intensive care team informing them and breaching their own policies. Both clients engaged my one-on-one counselling and consulting services, and with my insights, help, strategies, as well as negotiation skills, we managed to get both NFRs and DNRs revoked, and both of my clients' family members in intensive care are still alive. Again, I have written an ebook about the 5 things you need to know if the medical team in intensive care wants to limit treatment, withdraw life support, or wants to issue a DNR, do not resuscitate, or NFR, not for resuscitation order for your critically ill loved one. Again, check out the link in the written version below this blog, below this video. Number 9. The intensive care team is giving you and your family limited access to your critically ill loved one by limiting visiting hours. I'm still shocked and amazed to find that some intensive care units still have limiting and restricted visiting hours that feel like they are from the 1950s. Some intensive care units still lock out families in intensive care for most of the day and have visiting times from 10 a.m. to 12 p.m. and 4 p.m. to 8 p.m. It makes you wonder what intensive care units have to hide. It also really makes you wonder how transparent and family-friendly intensive care units are in their dealings with their families. I have written 2 articles about that. One is what are normal visiting hours in intensive care, and the other article that I wrote was what the doctors and the nurses' behavior in intensive care is telling you about the culture in an intensive care unit. Let's move on to number 10. And it's another one of my favorites where the senior medical staff, the title of number 10 is the intensive care team is delegating important communication to junior doctors or junior nurses. This is another one of my favorites where the senior medical staff or senior nursing staff are trying to delegate difficult and important communication to inexperienced and junior doctors or nurses. It's a clear sign that they don't want to deal with you and your family. In fact, it's quite condescending, if anything. And again, I see it over and over again. What happens is that some of the senior medical staff or some of the senior nursing staff don't want to deliver you and your family bad news, and they delegate this to junior staff, medical or nursing. It's a clear sign of disengagement, and it's a clear sign that they are jaded of dealing with families of critically ill patients in intensive care. They can't face the mark, and they are not skilled enough to have difficult conversations, and they also want to wash their hands clean. This is a strategy that's doomed to fail, especially if you have been following my blog here for a while, because I can help you and your family very quickly to make informed decisions, get peace of mind, control, power, and influence. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power, and influence very quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, getting peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counselling with me via Skype or over the phone and via email by clicking on the email and phone counselling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.